Now, the thoracoabdominal aorta is the continuation of the descending aorta. Generally is the same diameter as the descending. It essentially connects the descending aorta to the abdominal aorta, and it travels through the diaphragmatic hiatus of somewhere between 4 to 8 inches. And when it ends at the visceral branches, which are the branches that carry blood to the abdominal organs, including liver, spleen, and pancreas, as well as bowel and 2 kidneys, the aorta, because of those branching, also has added a strength to it. This picture is really the hallmark of a patient with TAD syndrome. As you can see, the aortic annulus gets a little bit larger because of the presence of connective tissue abnormality and more elasticity of the tissue. TAD patients have, generally speaking, beautiful coronaries. They are free of atherosclerosis. Of course, there are exceptions to this, as patients who do smoke or they have other associated genetic predisposition to atherosclerosis. The aortic root that contains the 3 sinuses and aortic valve generally enlarges, and they develop an aneurysm. Even the left main and the right coronary arteries, they at the takeoff from the sinuses, they enlarge, as you can see in this particular CT image. The ascending aorta dilates and forms an aneurysm. And as it reaches the aortic arch, you can see the dilation slows down because inherently aortic arch is in a much stronger position. And in this particular image, you can see that aortic arch is elongated. This is a TAD aorta. In a normal aorta, aortic arch is shorter than this. And one particular note here that it is not quite obvious, but this is a bovine arch anatomy, that the takeoff of the left carotid and innominate artery both are from one ostia. And as we know, more and more these days, patients with bovine anatomy have a higher incidence of aortic dissection. In the descending aorta, you can also see the tortuosity of the descending aorta, and this is simply because of the connective tissue abnormality that aorta not only dilates but elongates, and because it has a fixed end, the top and the bottom portion, the length increases and it starts becoming tortuous. Just looking at this picture gives you a good idea that patients with the aneurysm of the root and ascending aorta have always subject of speculation that what size is really an aneurysm and what diameter is called normal. In the past, many surgeons have thought that if the ascending aorta becomes twice as big as a descending aorta, it's really called an aneurysm. But we know in a past experience, this can really put many patients in harm's way, as we know in, for example, in bicuspid patients, their descending aorta is dilated and large also. So if we really want to wait for their ascending aorta to become twice as big as descending aorta, we have noticed we will lose some of these patients. As the IRAT data has shown, there is a 60% risk of dissection in patients who are less than 5.4 centimeter in diameter. However, this potentially might be a good way of looking at patients who have a truly normal descending aorta and we can compare their ascending aorta to the descending. So if the descending aorta is dilated, this technique, it really underscores the importance of their ascending diameter. But however, if the descending aorta is small and normal, then this potentially can help. This is another 64 slice CT that has shown one of our patients with the bicuspid aortic valve and TAT syndrome. You can very well see how the ascending aorta is dilated. Also, notice that he has a bovine anatomy. It's a common ostia to the innominate artery and left carotid artery, and then a separate ostia to his left subclavian. Notice that his descending aorta is rather large. So really, comparing the ascending aorta to descending aorta will underestimate the importance of the size of the ascending aorta. This patient underwent surgery and had his ascending aorta resected. Aortic valve was resected, and also he had paroxysmal atrial fibrillation and ended up with having a Cox-Maze procedure. And as we know today, he's doing very well.